patient assessment. I have my patient here. I approach, I make sure my scene is safe, I make sure that I'm safe, I have my gloves on, and assuming there is no other need for body protection. I will look at my environment, nice sunny day today. I will look to see if I have any bystanders, anybody see what happened. I do not have any responses to that. My general impression, my MOI is not clear to me at this moment, and my partner is here, and I'm going to ask him to hold neck stabilization as I check the airway. I check the airway, I look, listen, and feel for breathing. I open the mouth and make sure that he has no debris in his mouth, or I would remove that if I can see it. What do I have for respiratory rate?
It's inadequate.
He has an inadequate respiratory rate. I'll ask my partner to bag valve him on a bag valve mask, one breath every 5 seconds. Flow rate will be 15 via an O2 tank. I will continue to assess the chest. Before I do that, I like to put my adjuncts in. I'll put an oral airway and 2 nasal pharyngeal airways as well. As I move down, I will make sure that the chest, I have normal rise and fall of the chest. I will palpate quickly, making sure that it is essentially intact. After I check that, I will then check for to make sure I straight his midline and that he has no JVD. I will check a carotid pulse, measuring it with a radial pulse as well, making sure that they are equal and they appear to be. What is my rate and rhythm of my pulse?
Rapid and thready.
I'm concerned about this patient a lot. This is going to be a rapid transport, and I will ask for somebody to get me a backboard as well. I will then check his entire body for gross bleeding, each time checking my gloves. Go down to the hip. I do not find any major bleeding. I will look for skin color and make sure that he's not cyanotic or ashen in any way, or note that. I will then begin my secondary survey, my rapid body scan. I've already called for my backboard, and I will check his head for decap BTLS, any major issues or structural issues. I'll check his neck. I will feel in the back of his neck for any step-offs. Check for a medical alert brace necklace at this time. I am not seeing any. His trach continues to be midline and I see no JVD. I will ask my partner to put a collar on this person and remain holding neck stabilization. I'll move down to the chest. I will check the clavicles, scapulas, as well as each side of the chest independently, and to continue to make sure that I have equal rise and fall. I will check the abdomen using a 2-hand method, all 4 quadrants, while observing his face for any wincing or pain as I check that. I am not seeing any. I go to the hips, I push up, quickly note if there's any priapism noted to help me rule out a spinal injury, and making sure that the hips are stable. I'm going to go down the legs. I'm going to check for a popliteal pulse, if I can feel that, but very quickly go down, make sure I have a DP and PD pulse. I'm not going to spend a whole lot of time doing that. This is a good time to ask him to wiggle his toes. If he's going to respond, push, pull. He's not doing anything like that at this time. I'm then going to go up to his arms. I'm going to check the arm closest to me first. I'm going to check for cap refill, radial pulse. He appears to have one, and leave his arm position there. Reach across, do the same thing to this arm. I'm also looking skin turgor at this time as well. I'm then going to ask my partner to position the backboard behind him, and I'm going to roll him on his side. I will check his back for any step-offs, back of his head, buttocks, his legs, whatever I could not visualize earlier. I'll roll him back onto his back, onto the board. We will move him to the ambulance rapidly. We will notify a trauma alert team, paramedic intercept, and this is a load and go. Once in the ambulance, my secondary survey will continue. I will check once again for decap BTLS for his head, making sure that I see no issues with that. Check his jaw, check his maximal as well. I will look in his ears to see if I have any drainage, and behind the ears for any battle signs. I will look for raccoon eyes under his eyes. And check his pupils to make sure that they're equal reactive light and accommodation. His pupils seem to be at this time. He continues not to respond. I will look through the hole in the collar, making sure that the trach is still midline and making sure that he has no JVD. I will then move down to his chest again, palpating the scapulas and clavicles, shoulders, making sure that the shoulder girdles are intact. I will check each side of his chest individually for any issues. I will then check the other side. And once again, I am looking for symmetrical movement of his chest. I will then do the abdominal palpation, again looking to see if I have any new wincing or anything like this. Is a good time to do rebound tenderness as well in the abdomen. Again, at the hips, I'm going to push up, not push down, and making sure that he has no priapism, helping me ascertain a neurological injury. I will move down both legs, looking for any swelling or deformities that I may have missed the first time going through. Check under his knee. Come down here, I'm going to check a pulse. Also, I will check a Babinski to make sure that his toes respond appropriately, helping me with the neurological assessment. I will also check for a pulse at this time. And if he has anything on his ankles that I may have missed, like a medical alert. Moving up to the arms, medical alert there too. Check both arms. Can you squeeze? Can you push? Can you wiggle your toes? He's not doing anything I'm asking him to do. Check the other arm. Check for pulse. Check for cap refill. Skin turgor at the wrist. I will also listen to his lungs, putting a stethoscope, making sure that I have good ventilation with his lungs, as well as a BP cuff. I will check for a blood glucose, EKG, call my report into the ED, and I will then hope for my paramedic intercept soon.